Hi, my name is Mario, and I'm going to be talking to you about workplace violence against nurses. Violence in healthcare, a growing crisis. Violence in the healthcare setting has become a growing crisis for many nurses and healthcare workers across the country. Nurses are now experiencing some of the highest rates of workplace violence ever reported in the professional setting. Um, According to research, it kind of suggests that nurses are about 4 to 5 times more likely to experience workplace violence compared to workers in other professions. This violence may come from patients, visitors, family members, or even coworkers. Nurses spend most of the time with direct interactions with patients, especially in the ER. They often become the primary target of this aggression because they're the first person that the patient meets contact with in these types of environments. Understanding workplace violence in healthcare. Workplace violence in healthcare can take on like many forms, a variety of different forms, such as it can include physical assault, harassment, threats, and or intimidation in the healthcare workplace, or while performing your daily duties. Violence can be both physical and psychological. Physical violence can include behaviors such as hitting, pushing, biting, while other psychological behaviors are often verbal threats and harassment. Some studies suggest that healthcare workers account for nearly 73% of all non fatal injuries related to violence in the United States. These statistics kind of reveal very serious issue that of workplace violence within the healthcare settings in the United States. Forms of violence in healthcare. Nurses can experience several types of violence while performing their duties. There are many types. Like a physical assault may be, as I mentioned, kicking, pushing, hitting, biting by patients or visitors. Verbal abuses and threats are also very common, and they involve like yelling and intimidation and aggressive language. Nurses may also experience bullying and intimidation from coworkers as well. This doesn't just pertain to patients and their families, um, and can contribute to a hostile work environment. So, but as well as sexual harassment is another form of violence that occurs that nurses may encounter, especially female nurses with male patients. Research suggests that more than 50 percent of nurses experience a form of verbal abuse at work, while 25% of report experiencing physical violence from patients or family members. The statistics behind workplace violence. According to the statistics, one out of every four nurses experience physical assault at work. In addition, research published in 2024 also revealed that um, nearly 70% of nurses report experiencing some form of violence in the workplace. Surveys also conducted in the healthcare organization show that more than 80% of nurses have experienced violence at some point in their careers. These statistics reveal that the workplace violence is not just an isolated issue, but it's more like of a major occupational safety concern within the healthcare space, and it needs to be resolved. The causes for violence in the healthcare settings. Several factors influence or contribute to violence in healthcare settings, such as long wait times and overcrowding in hospitals can increase frustration amongst patients and visitors. Mental health illnesses or even psychiatric conditions may also increase the likelihood of more of that aggressive behavior. Substance abuse is another common factor associated with violence in the healthcare environment, especially in the ER, as I've seen personally. Additionally, staff shortages can also create a lot of stress for not only the healthcare workers but the people in the waiting room. Therefore, leading to more situations between patients and healthcare workers. And lastly, emotional distress experienced by the patient and family members, especially in those situations where emotions are already really high, can escalate into aggressive behavior towards healthcare staff. High risk areas for violence in hospitals. There are certain areas within hospitals that have higher risk of workplace violence compared to others. The emergency department is often considered one of the highest risks due to the um, high levels of stress and the unpredictable behaviors from the patient um, in emergency care. Intensive care units also have violence because the patients may be critically ill or a lot of times confusions. Long-term care patients in facilities may also see increasing aggression due to like cognitive issues such as dementia, Alzheimer's. Psychiatric units also experience high rates of violence due to the patients experiencing crisis due to their mental health or mental illnesses. Research also suggests that the emergency room nurses report the highest rates of workplace assault compared to the other hospital departments. The emotional and physical impact. Workplace violence can have a significant emotional and physical effect on nurses. Nurses may experience anxiety or fear when it comes to coming in for work or after experiencing a violent incident. Repeated exposures, especially to violence, can lead to decreased job dissatisfaction and burnout. Emotional stress and trauma can may develop over time, therefore cause especially after experiencing incidents quite frequent and often. In addition to the emotional effects, nurses also experience high physical injuries during violent encounters with patients. Research suggests that approximately one third of nurses report psychological distress after experiencing workplace violence. How violence affects patient care. Workplace violence can negatively impact patient care. When nurses feel really unsafe or stressed, it can become very difficult for them to like provide high quality care for these patients. So you'll see a reduced quality of care, stress and distractions may increase medical error for these patients. Violence can also disrupt the communication between healthcare providers and patients, which can lead to less effective care in that settings. In addition, when it comes to unsafe work environments, it can also be contributed to staff shortages when nurses choose to leave their position. So ultimately, when you think about it, violence in healthcare settings can lead to poor patient outcomes and therefore lower quality of care. Why nurse? Why violence goes unreported? So it's very unfortunate, but many incidents that involve workplace violence goes unreported in the healthcare settings. Some nurses believe that violence is simply part of the job and therefore must not be reported. But others fear that retaliation or they believe that the management will not provide adequate support when it comes to reporting these types of incidents. Reporting um, can also be complicated and time consuming, which can discourage a lot of these nurses from reporting incidents. Because of these barriers, true numbers of violent incidents in the healthcare settings is much likely to be higher than what's officially reported. Strategies to prevent violence. So there are several strategies that can help reduce workplace violence in healthcare setting. One important strategy is improving staffing levels so that nurses can respond more efficiently to situations um, that can be found on the floor. Increasing security personnel and installing like surveillance systems can also help improve safety, especially if it can be accessible from the nurses station where nurses also are able to see. Educating and training to teach the fellow healthcare staff how to recognize early warning signs of aggression and how they can use communication techniques to kind of de-escalate situations can be quite important. Finally, it's extremely important for all healthcare workers to tell and continue to spread the word that it's important to report all violent incidents so that the organization can identify these patterns and or even just to cover your own back and improve um, the safety of others as well and maybe push for policy reform and change. Lastly, for my conclusion, workplace violence against nurses is very serious and it's a growing issue within our healthcare system. Many nurses will unfortunately experience some form of violence during their career. However, it's very important that we recognize these behaviors and we should not normalize it or accept it as part of our jobs. We should continue to report these incidents. By doing so, we might improve safety policies and maybe um, therefore activate better protocols for us. Um, by also improving and increasing staffing levels and providing training on violence prevention, we can reduce workplace violence as well. Therefore, creating a safer work environment that will protect nurses and improve the staff's well-being, and maybe ultimately lead to better patient care. Lastly, I would like to give a personal experience. Six 2 months after I graduated from nursing school as an RN, I experienced my first ever workplace violence incident. I was pinned against the wall from a fellow patient's family member and was screamed at and yelled at and verbally abused to a point where I had to get somebody else to pull the patient off of me. It was very traumatizing and it took me a little bit to kind of overcome that situation personally, but it didn't hold me back from continuing and loving the career of nursing. So hopefully that kind of gives a little reminder that although it can be quite scary sometimes, it shouldn't deter you from loving this career and pursuing to help others.